Bismillahirrahmanirrahim. Now I am going to discuss about the femoral nerve. You should know about how femoral nerve is originated, what its root value, what is the course, what is its distribution, what are its branches, and what are its relations. Now the femoral nerve. Femoral nerve is basically the largest branch of the lumbar plexus. Once you will read about the lumbosacral plexus, then you came to know that this is the diagram. I can show you. Here is the lumbar plexus. You can see this is L2, L3, L4. These roots come together and they will finally form a major terminal nerve. This is the femoral nerve. Okay, the femoral nerve is the largest branch of the lumbar plexus, and this nerve has a root value L2, L3 and L4. Okay, now here in this diagram you can see L2, L3, L4. They combine together to form the femoral nerve. Once the femoral nerve is originated, it is basically descend posterolaterally and originates in the abdomen within the psoas major muscle. This is a psoas major muscle. You can see it, here it is cut down. This it lies within the psoas major muscle and then descend posterolaterally through the pelvis, approximately up to the midpoint of this inguinal ligament. Okay, this is the course just that is lies above the inguinal ligament. This is the inguinal ligament, and this femoral nerve is reaches to the midpoint of the inguinal ligament by passing posterolaterally within the psoas major muscle. So once it reaches to the midpoint of the inguinal ligament, now you can see in this diagram the relation. This is the femoral nerve. It lies. This is the psoas muscle tendon, and this is the iliacus muscle. Okay, this femoral nerve lies just in front of that, and in this diagram you can see that it lies outside the femoral sheath and lateral to the femoral vessel. Okay, once it enters into the thigh, it lies lateral to the femoral vessels, and it is present outside the femoral sheath. Okay, femoral nerve is basically the chief nerve of the anterior compartment of thigh. It enters the femoral triangle by passing behind the inguinal ligament. Now it enters into the here you can see it enters into the femoral triangle. It by passing behind the inguinal ligament lateral to the femoral femoral vessels. Okay. Now just after a very short course of almost 2 to 2.5 centimeter below the inguinal ligament, it divides. Okay, it gives branches. Okay. After entering into the femoral triangle, the femoral nerves divide into several branches to the which it gives muscular branches. The muscular branches to the anterior thigh muscles. It gives articular branches which give it to the hip joint and knee joints. It provides several cutaneous branches to the anteromedial side of the thigh. Okay, the anteromedial side of thigh. And the terminal cutaneous branch of femoral nerve you cannot see here. I will show you another diagram in which you can see the terminal branches. This is the femoral nerve. Here you can see this is the midpoint of the inguinal ligament. It enters into the thigh and divides into several branches: muscular, articular, cutaneal. And then it is one of the terminal branch of the femoral nerve is the nerve saphenous nerve. Okay, this is the saphenous nerve. The saphenous nerve descends through the femoral triangle. Okay, it originates inside the femoral triangle. The saphenous nerve is very important because it is the terminal cutaneous branch of the femoral nerve. Be remember, it is a terminal cutaneous branch of the femoral nerve. Okay, this saphenous nerve descends through the femoral triangle lateral to the femoral sheath. Femoral sheath से ये बाहर होती है. It is lateral to the femoral sheath, and it containing the femoral vessels. Along with these femoral vessels, it runs downward. This is the saphenous nerve. It accompanies the femoral artery, femoral vein through the adductor canal. Now here is the adductor canal. See, it enters into the adductor canal along with the femoral artery and femoral vein, and it becomes superficially passing between the sartorius and gracilis. Here is a sartorius muscle. You can this muscle is cut down here. Okay, this one is the sartorius. यहाँ sartorius muscle होता है, and along with it is the gracilis. Okay, now after passing from the adductor canal, it becomes superficial and traverse the adductor hiatus. Here is the adductor hiatus, traverse the adductor hiatus at the distal end of the canal. Then it runs anteroinferiorly to supply the skin of and fascia of the anteromedial aspect of knee, leg, and foot. Okay, this was a small short course of saphenous nerve as well. So the main branches of the femoral nerve is the muscular branches, cutaneous branches, and their articular branches. And one of the most important cutaneous branch of femoral nerve is the saphenous nerve. Uh, this was all about femoral nerve in its course.